This is a study that we did with Teva Pharmaceuticals, and we also did it with multiple other practices around the country, looking at a different kind of progesterone to give women after in vitro fertilization. And in this study, we looked at a vaginal ring and we compared it to a vaginal gel, both of which are far superior to the old way of giving progesterone, which was by intramuscular injection. Big needle in the hip. Women hate it, and it's one of the most common reasons that women refuse to do in vitro fertilization, or certainly the most commonly cited reason why they don't like in vitro fertilization, or what they hate about it. So the bottom line is that we studied this vaginal ring to see if it was just as good or just as effective as a vaginal gel, and we compared that to the intramuscular progesterone. And what we found was that women actually liked the vaginal ring. Their satisfaction with the ring was very, very high. They liked the gel also. Satisfaction, again, very high. Both of them were far superior to intramuscular progesterone. So in this graph, we asked women who had previously taken a different type of progesterone how the new progesterone that they took in this study compared to the progesterone they had previously taken. And what you can see is the progesterone gel is in the red and the pink, and the progesterone vaginal ring is in the purple and the light purple. So when we asked them about, is it messy? Well, you can see that 36% of women who used the progesterone vaginal gel thought that it was less messy than what they had used before. 84% of women who used the vaginal ring thought that it was less messy. When we asked them about convenience, 77% who used the ring thought that it was more convenient than what they had used before. 56% who used the gel thought that it was more convenient. We asked them if it was stressful to use. 77% said that they had less stress using the ring. 57% had less stress using the gel than what they had used before. And when they asked about vaginal leakage and vaginal irritation, 62% of women who used the vaginal ring were satisfied. They said that they had less vaginal leakage or less vaginal irritation. 26% of patients who used the gel said they had less leakage or irritation than what they had used previously. So in summary, patients now have a lot of different choices for different types of progesterone that they can use after in vitro fertilization. The best news of all for our patients is that they no longer need to use these big needles, shots in the hip every single day for 11 days or more. In fact, sometimes if they're pregnant, the injections could go on for weeks. Now we've got another good option. We have vaginal gel, which is Crenone, which is what we use in our practice currently. And there's also something else on the horizon if it comes to market, and that's a progesterone vaginal ring, both of which are terrific options for our patients. They're painless, they're far less messy than other options that are out there, and they work very well.